Good morning. It's April 24th, and this is your daily brief in science. Here's everything you need to know. In a testament to human ingenuity and the durability of space exploration technology, NASA's Voyager 1 spacecraft, after months of silence, is back in communication with Earth, sending back valuable data from the edge of interstellar space. This breakthrough comes after the spacecraft began transmitting indecipherable binary code, challenging the team at NASA to diagnose and fix the issue from billions of miles away. Launched in 1977, Voyager 1 has been a key player in humanity's quest to explore beyond our solar system. Since 2012, it has been traveling through interstellar space, providing unprecedented insights into this uncharted territory. Its twin, Voyager 2, launched around the same time, continues its own journey at 12.6 billion miles from Earth, still in regular contact with mission control. The issue with Voyager 1 centered around a malfunctioning chip within the spacecraft's computer system, a relic from the 1970s. NASA's ground team, working from the Jet Propulsion Laboratory in Southern California, managed to identify and rectify this problem, allowing the spacecraft to resume sending usable engineering data back to Earth. This data is crucial for understanding the health and status of the spacecraft as it ventures further into the unknown. The distance between Voyager 1 and Earth is so vast that signals take approximately 22.5 hours to travel each way. Despite this, the team's perseverance paid off late last week when they received good engineering updates, marking a significant milestone in space communication. This achievement not only underscores the challenges of deep space exploration, but also highlights the enduring legacy of the Voyager missions. As Voyager 1 continues its journey, now over 15 billion miles from Earth, its ongoing mission remains a beacon of human curiosity and our desire to explore the cosmos. In a milestone event for SpaceX, the company celebrated the 300th landing of its Falcon booster, a testament to its reusable rocket technology's success. This achievement came with the launch of the Starlink 6-53 mission from Cape Canaveral, Florida, underscoring the company's ongoing efforts to expand global access to high-speed internet through its constellation of satellites. The Starlink 6-53 mission saw the deployment of 23 broadband satellites into low Earth orbit. These satellites are part of SpaceX's ambitious project to weave a network capable of delivering fast internet connectivity worldwide. The launch was initially delayed due to weather concerns, but ultimately found a clear path to the skies on Tuesday, thanks to a favorable 95% launch forecast. This launch is part of a broader set of missions SpaceX is undertaking, including further crewed missions to the International Space Station as requested by NASA. The company's schedule remains packed, with plans for back-to-back launches over the weekend. These include a potential mission to deploy Galileo satellites for the European Space Agency and another Starlink mission. However, not all news has been positive for SpaceX's Starlink project. The FCC recently denied the company's nearly $1 billion bid to provide Starlink internet service to rural areas in the U.S., a decision that impacts the funding and expansion strategy for the project. For those following SpaceX's rapid cadence of launches and its contributions to both commercial spaceflight and global internet access, updates and detailed coverage can be found at floridatoday.com/space. This site offers the latest on activities at Cape Canaveral Space Force Station and NASA's Kennedy Space Center, keeping space enthusiasts and the public informed on the next steps in space exploration and connectivity. A groundbreaking study from the University of California, Los Angeles brings to light the significant impact of physician gender on patient care outcomes. This research, published in the Annals of Internal Medicine, identifies female physicians as providing notably better care for their patients, with tangible benefits reflected in lower mortality and readmission rates. The study highlights that female doctors not only establish stronger rapport with their patients, but also engage in more effective communication. They tend to allocate more time for each visit, allowing for a more comprehensive patient history and encouraging shared decision-making. This approach may make patients feel more at ease when discussing sensitive information, fostering a healthcare environment where patients perceive their physician as more relatable. While the study stopped short of pinpointing the exact reasons behind the superior outcomes associated with female physicians, it suggests that reduced miscommunication, misunderstanding, and bias could play significant roles. Dr. Megan Ranney from the Yale School of Public Health underscores the potential influence of empathy in patient care, noting that female physicians may naturally exhibit a greater degree of empathy towards their patients. Yusuke Tsugawa, the study's author, emphasizes the critical importance of delving deeper into the gender dynamics of patient care, suggesting that a better understanding could lead to significant improvements in healthcare outcomes. Additionally, the research draws attention to the heightened risk of mortality for patients admitted over weekends, underlining an urgent need for healthcare systems to address these disparities. This study serves as a call to action for all physicians, particularly males, to become more cognizant of their implicit biases and communication styles. By doing so, the healthcare community can work towards ensuring that all patients receive the highest standard of care, regardless of the time of their admission or the gender of their physician. In a leap toward the future of medicine, Tessera Therapeutics is set to join forces with Sania Therapeutics, Editas Medicine, and Affinia Therapeutics at the American Society of Gene and Cell Therapy 2024 annual meeting. This gathering marks a pivotal moment as these biotech innovators unveil their latest advancements in gene therapy, signaling a new era in the treatment of genetic diseases. At this highly anticipated event, Tessera Therapeutics will take center stage to showcase new preclinical data on in vivo therapies targeting genetic diseases. Their presentation will cover groundbreaking developments in T-cell-based therapies, including cutting-edge RNA-based gene writing and lipid nanoparticle delivery methods. Notably, Tessera will highlight their progress in gene editing techniques aimed at correcting mutations responsible for sickle cell disease and Wilson's disease, demonstrating these technologies in an engineered disease mouse model. The significance of these presentations extends beyond the scientific community, as they will be made accessible to the public on the company's respective websites during the conference. This initiative ensures that the latest advancements in gene therapy are shared widely, fostering greater understanding and anticipation of future treatments. For those interested in delving deeper into these revolutionary therapies, more information can be found by visiting the websites of Sania Therapeutics, Editas Medicine, Affinia Therapeutics, and Tessera Therapeutics. This collaborative effort at the American Society of Gene and Cell Therapy 2024 annual meeting not only highlights the rapid progress in gene therapy research, but also underscores the potential of these technologies to transform patient care for a myriad of genetic disorders. Diving deep into the ocean's past, a groundbreaking study has unveiled the ancient roots of bioluminescence, tracing it back to a time when the earliest marine creatures began to light up the depths of the Cambrian seas. This discovery not only illuminates the origins of this mesmerizing trait, but also opens up new avenues for understanding the evolutionary journey of marine life. The research, published in the prestigious journal Proceedings of the Royal Society B, highlights the earliest known occurrence of bioluminescence in marine organisms, dating back approximately 540 million years ago. By examining genetic similarities among octocorals and their relatives, scientists have pinpointed the last common ancestor of these creatures as the pioneer of light emission. This ancestor lived during the early Cambrian period, a time when life in the ocean was diversifying at an unprecedented rate. The study proposes that the initial emergence of bioluminescence in octocorals was likely a serendipitous offshoot of an ancient antioxidant-like pathway. This adaptation, initially serving a different purpose, eventually became a defining feature for these organisms, enabling them to thrive in the ocean's depths. The ability to emit light not only facilitated their expansion into darker waters, but also marked a significant evolutionary milestone in the history of marine life. These findings offer profound insights into the evolutionary history of bioluminescence among marine organisms. Understanding how and why these creatures developed the ability to glow sheds light on the intricate relationships between evolution, adaptation, and survival in the deep sea. This study not only charts the ancient origins of bioluminescence, but also underscores the complexity and interconnectedness of life on Earth, revealing how a single trait can open up a whole new world of ecological niches and evolutionary pathways. This has been your daily brief in science. To read more about these stories, follow the links in the episode bio. You can also subscribe to these updates via email at www.brief.news. For more daily podcasts about the topics you love, visit brief.news/podcasts. Tune in tomorrow. We'll be back with everything you need to know.